Hello, I'm City of Scottsdale Communications and Public Affairs Director Kelly Corsette. And once again, I am here speaking with Scottsdale Mayor Jim Lane about the city's ongoing COVID-19 response and the public and policy issues that the mayor is dealing with as the city and the community continue to work to contain the spread of this virus and look toward the day when things can return to a bit more normalcy. So thank you, Mayor Lane, for joining us. You've been doing a few of these interviews throughout the past couple of months, and this is my second opportunity to speak with you here and really give you a chance to answer some questions, and in doing so, help Scottsdale residents and businesses learn about the things that we are doing. So thank you for being with us. If you're ready, I'll dive right in with the first question.
Certainly, but thank you, Kelly. It's always nice to be talking to you about these things and be able to communicate some of the things that are not necessarily known on a day-to-day basis of how we've progressed in that. But please go ahead.
Well, thank you, Mayor. First off, we are nearly 5 months into learning about and dealing with the world of COVID-19. So how do you think we are doing so far in Scottsdale?
Well, in that we're somewhat writing the manual on something like this. This is not something that any of us have come to the table with a set of plans or an operational manual or a guidance manual. And it has progressed in an interesting way as we've developed better information, more accurate information, better pools of population to draw upon, and just even the trend lines that develop through the course of this. It has been evolving, and I think in a positive way in our responses, because we've become much more educated on a number of different levels as to what we're dealing with and what we're not dealing with, as some of the projections in the early models set us on a different course than we are on right now.
So, Mayor, you mentioned looking at information and data. As you are considering these things and making decisions in a lot of cases, such as the face covering order and the recent extension to that order, what points of information do you rely upon, and who are the trusted people with whom you speak regularly?
Early on, we were really dependent upon what had happened in other regions of the world and other regions of the country. So the dependency there really went to what the federal government was indicating through the CDC and otherwise, and even from other sources that they may draw upon. And as I mentioned a little while ago, the models that were based upon oftentimes flawed, sometimes false, and sometimes inadequate information that, with a lot of uncertainty, put us on a path of uncertainty and some difficulty with a number of different opinions as to the veracity and or the viability of some of the data that we were receiving and we were using. But that's evolved too. So early on there was a lot of dependency and there still is in this case with the state's development of trends within the state. But early on there was very little to work with, and the assemblage of that data was somewhat challenging. So it's moved to the Arizona Health and Human Services site, ahs.gov, which has really become a very comprehensive source of solid, verifiable data that has been built over the course now of several months, and that has really given us a clear indication of trends, and frankly, to be able to take those trends and the statistics that are derived from them to develop consequential effects of the things we want to avoid, most notably overtaxing healthcare resources. So those are, and the people I speak to are other mayors, but more importantly, particularly to the issue of healthcare resources, are our healthcare providers, the CEOs at Honor Health and at the Mayo of Arizona and even a Banner, as a matter of some routine, finding to make sure that what they're experiencing is actually reflective of the very things you might calculate through the trends and the statistics as they evolve through the course of additional testing and other things that have brought us to the point we are today.
Mayor, in those conversations, has there been anything surprising that you've learned in speaking with the directors and the leaders of those healthcare organizations?
That's an interesting and a good question, and I would say yes, there have been some things that are surprising, and I would say most notably is that there are differences of opinion on the basis of what actually is happening in their organizations as they follow the management rules with regard to now the healthcare resources, whether it's ICU beds or just hospital beds in general, or ventilators, or just hospital resources in the way of staffing and PPEs, PPEs. Those are all things that factor into each of their opinion and sense of their security and what they were trying to do. During the first shutdown was the effort that was really a non-challenged kind of thing because we really weren't very deep into the onslaught of the infection. And that was how they saw the development of the effort to tamp down a spike, an anticipated spike, which would have put a strain on our medical resources. That strain never came about, even though we saw a small spike that we were easily to tamp down. But on the basis of that sort of early information, we were set the stage for an opening up in accordance with the national scene. And all states in the union are not on the same timetable, but nevertheless on that basis. And on that basis, we did open up, and the things that have developed since then. But I would say that there was differences of opinion, but there also was some very definitive trust in what they saw as it developed here in the state of Arizona. Beyond that, I think that there was always a cautionary mark as to whether or not we were on the same timetable as the likes of Seattle, which had the first case on March 11th. No, I think I'm sorry, that's not right. It's January 21st as far as Seattle's concerned, and followed short order by Chicago. But we certainly weren't on the same wavelength with that or the East Coast. So there was an evolution of thought even within the people who would be the first to tell you they're not scientists necessarily in epidemiology, but nevertheless they have people around them that are trying to compile that information in order to derive the right sense of a model and projections going into the future. But it was very informative for me in any case. I don't know how surprising that might have been for me as well.
Well, thank you, Mayor. I want to go back to face coverings. I have here one of our official City of Scottsdale nose and mouth coverings that we have provided to all city employees. And just talk to you about this topic. In June, you signed an emergency proclamation that requires face coverings in most public areas in Scottsdale. And then, as I mentioned previously, you have recently extended that order until August 20th. Has the national or the local reaction to these kinds of requirements surprised you?
In the sense of the intensity of the issue, emotional intensity of it, yes. There are certainly two very impassioned points of view on this particular thing, and that is a personal freedom and their own personal responsibility and their willingness and desire to be able to contribute on the basis of their objective and certainly their concern for themselves and their fellow individuals in the city of Scottsdale. So that's impassioned on the one side, and the other side, because of really almost the terrorism that was invoked with the early models projecting 2.2 million people dying by this time this year. And thankfully, thank God we were not in that situation, but nevertheless, given that there was a certain amount of trust on the early models, which were flawed for a number of reasons. And I'm not in that science, but I do know statistics and population, the governance of the reliability of a projection on the basis of the population or the random sampling of a population that might be used to extend it or extrapolate on given results that are seen. But I would say that that's been probably one of the more important issues of just division on it. And certainly the feedback was vehement on both sides. But one thing about it is that mandate was, as we opened up under some an opening to open up and be safe in the first phase of what was delegated or indicated by the federal government as a three-phase approach on this, and we were following that through the state as well. But nevertheless, in the opening up, there were certain things in certain facilities and certain really opening up people mentally. They wanted to get back into doing the things they enjoyed to do and get back into it. And a lot of them were just not compatible with the social distancing that was still being called out for. Not necessarily mandatory masks, but certainly wearing masks under certain circumstances, again, on the basis of a voluntary adherence to guidance that was given by the CDC and by the state on a continuing basis, and maintaining their own personal hygiene by washing their hands and just being careful about their own personal health and whether they would show up somewhere and be of questionable health. So that was the way it was in the shutdown, and the population as a whole was very compliant, and I think we received a tremendous amount of adherence to it. But coming on the open up after 7 or 8 weeks of being shut down, it was very difficult to open up some of the things that were open with certain criteria, that being the bars and the nightclubs and the gyms and other things that just simply weren't going to be able to comply with that voluntarily or by mandate, even, as it turned out. And so that's really what precipitated the mandate, and that was to really to say, hey, in these circumstances, you have to be wearing them. Otherwise, there is no protection for yourself or others. Now, there's arguments as to which way the mask works for you or others and all manner of things. But that's part of the dilemma, is that a lot of different opinions, a lot of different science that's trying to be employed. And frankly, a lot of changes because of uncertainty that led to some distrust of overall. But the mandate was brought about by that, on that basis. But soon after the mandate was imposed, the governor did come through with a change to phase one, which closed nightclubs and bars with certain exceptions on that, and the gyms. So that we think was one of the reasons for an increase in infection, pardon me, and that is went from 5% to over 20%. So 1 in 20 were being tested positive to 1 in 5. And so that was a pretty clear sign, and this was real-time data. This is stuff that we knew and from our accumulation of the tests, but also of the statistics associated with it, that was going to ultimately cause an increase in hospital resource needs, demands. And we had opened up the hospitals to what we used to call non-emergency care, but that got backlogged, and that was back in the system too. So with the COVID infection rate rising to that extent, at a 5% hospitalization rate on any positive indications, you can translate that into what it's going to do to your availability of hospital beds, ICU beds, and ventilators, and frankly, resources on the overall, inclusive of staffing. So that's really what prompted me to that move for the city of Scottsdale, and county and others certainly followed suit on the same line.
Well, thank you, Mayor. I want to talk a little bit about the national scene and frankly, Arizona's position in national headlines related to COVID-19 cases during the month of June and even early July. Given that, what do you think are Scottsdale's particular challenges as we look forward to the time when we can focus on recovering and rebuilding our image as a desirable place to be for visitors and uh, also for businesses. What do you think challenges lie ahead for us in Scottsdale?
Well, I think that along with the rest of the country, we'll be able to recover, and I think it's a matter of a little bit of a scarred American psyche as it relates to the fears that are associated with this. And whether or not Arizona stands high on the line of fear, I don't really believe that to be the case. There's a bit of a timing issue as to how Scottsdale and the state of Arizona operated on the front end with the shutdown, but also in the open up and what we experienced in the recent surge. I think that we're going to find that we'll be able to work through this in a healthy manner and continue to this next phase eventually too, and to get, I believe, our economy back in motion. But that's going to require that a lot of people locally get settled on the issue that they either can be safe or that they can control their own safety as far as their health is concerned. And that's going to take a little bit of doing, but as we get there, I think we'll see the rest of the country see us as a good and a safe place that has managed, I think, the infection of COVID-19 well. So it's going to be, but airlines and a number of other things are going to be challenged as well in the same market that we have to deal with as far as our view among the people who love to come and visit with us here in Scottsdale.
Thank you, Mayor. Recently, the City Council approved specific allocations for more than $29 million in federal CARES Act funding for Scottsdale. What do you think is the most important way that this money can benefit the city's residents and businesses?
Well, it's always been dubbed in my mind as rescue and recovery from the consequential effect of steps we had to take in order to tamp down that curve and to do the things to protect ourselves. But a lot of that involved a significant amount of harm to employees of operations that were and businesses that were shut down or severely restricted, depending upon what stage you're at. And so I think it's really important, number one, and of course a number of those employees are our residents too, but nevertheless that there's employees that are in a much more questionable financial position than they were prior, and as a result of COVID-19, that we do whatever the best we can to assist them to get through this in a solid place, so that whether it's a utility help or whether it is rent help, and the eviction element of non-eviction during the period up until now, October 31st. Those are all things that help some of those people to manage through this period of time. So there's going to be a certain amount of that we're going to be addressing, and we are addressing, and other programs for people who have already been harmed and maybe they have seen no relief at all, that they've been unemployed this entire time and they're past the time, or they will be shortly, they would have been able to recover on any of the unemployment benefits as it was. Now, unemployment benefits still will continue, but nevertheless, as it was during the initial CARES Act allocations from the federal government. So those are important elements for both our residents, who are actually workers, and also our businesses. For other folks who are in a worse way by virtue of just a slowdown in the overall economy, we'll be looking to make sure that our elderly and our most vulnerable are protected as it relates to what it takes for them to be able to operate effectively and to be able to live their lives without too much denigration of the kinds of services that they're used to, and what we can be able to get back in and doing. And one of the ways we've done that as a city is to make sure that our facilities that service actually for after school programs, but also for our parks and recreation, but also for the elderly, to make sure that we have as safe an environment as possible for those. And that includes some of the food programs that are available through those agencies and operations, and the other assistance that's made available to folks that are either in those categories of vulnerability, whether it be by age or chronic illness or by even income status, and so that we can get those used. The other thing that's important for us as a community, and that's really to make sure that we're investing in Scottsdale being a safe place to be. We talk a little bit about the attraction from afar. One of the things we've had to invest some of those monies because they're a direct consequence of COVID-19, and I'm fully embrace that kind of effort, and that's to make our venues and our event centers places that are going to be welcoming and be visibly healthy places and safe places to be. And I think that's an important component for it as well. There's numerous other things that will be attended to as well in a help to maintain our overall culture and our Scottsdale position as it relates to our residents, our vulnerable, and also our tourists, potential tourists, as we hope to invite them back.
Well, thank you, Mayor. It's nice to hear some positive things, and I know people will appreciate learning about that. So I'd like to close with this and ask you, with unfortunately so many of the national headlines, not just specific to Arizona, but just in general, being fairly dire in a lot of respects. What things do you see here that give you optimism for our future here in Scottsdale?
Now, this may sound like a sort of a light point to make on this, but at the same time, I think it's an important one, and that is that I think how we manage our way through this surge, being mostly open rather than mostly closed or altogether closed, I think is going to spell a path toward moving forward, because the COVID-19 is going to be with us for a while yet, without an immediate and complete resolve. So contending with it and working with it, and I don't mean working with it in any kind of sense of positive thing, but acknowledging its limits and its threats to those limits, that we're able to work through that. If we can show as a positive model of how we manage through a surge and reverse those numbers. Now, it's not all going to be up to us. It's going to be a little bit of luck on some things. There's no doubt about it. I'd love to return us back to a voluntary and a compliant and a together community. And that's the thing I'm hoping for, and that'd be the sort of the ray of light as far as I'm concerned looking forward in the future. I do anticipate that, and I think that we have that opportunity really to be a model for how we attend to this and keep ourselves in civil and emotional order, that we're going to be the Scottsdale we have been in the past as a community.
Well, thank you very much, Mayor. Those are all the questions I had today. Are there any other thoughts you have or things you'd like to share before we wrap up?
Well, all I would say at this point in time is we continue to evaluate the mandatory component, and that we have a sort of double coverage on that because the county's got it right now, but it's the same kind of mandatory mask requirement as we do. And so we've been working with them as well as watching and conferring with all the same people and the same statistics and places of information that I mentioned before, to watch and see how we're moving forward. And I think that we've got room to improve. And thus far, and if you can't see that I'm knocking on a piece of wood, thus far I should say, we are really working with the healthcare system to make sure that we don't have a double problem by overtaxing or overwhelming our healthcare facilities. That would be a catastrophe we don't want to see. And if you look around the world, it has happened. I don't anticipate it happening here. We're on top of this in a big way, and I think we will continue to be.
Well, thank you very much, Mayor. I appreciate the opportunity to speak with you and hope that the Scottsdale residents also appreciated hearing from you on these very important topics. So thank you for joining us, and glad to see you are well, and look forward to speaking with you again in the future.
Thank you, Kelly. It's always a pleasure to speak with you on these subjects, and I know they're important ones to communicate. And really, my best wishes to our entire Scottsdale community, and frankly, the state as well. And remember to wash your hands and watch where you go, and wear the mask wherever it's appropriate for sure. And then, of course, to keep that distancing up as best we possibly can. So it can be a healthy world again, and we're heading for it.